Hi everyone. So the topic I will be speaking to you about today is mental illness. Mental illness, according to the Mayo Clinic, refers to a wide range of mental health conditions. These conditions affect moods, thought process, and behavior. A few examples of mental illness conditions are depression, anxiety disorders, schizophrenia, bipolar disorders, eating disorders, and substance abuse disorders or addictive behaviors. According to the American Psychiatric Association, nearly 1 in 5 US adults experience some form of mental illness. 1 in 24 has a serious mental illness, and 1 in 12 has a substance abuse disorder. I'd like you to think a little bit about the numbers and how common it is to have mental illness nowadays. I believe that it has always existed, but I think that now we are moving towards wanting to end a stigma around mental illness. I also want you to think about how much this can control someone's life, because it is directly associated with the way that we think, our emotions, and the way that we act. Some of the causes of mental illness are combinations of genetic, biological, psychological, and environmental factors. They have nothing to do with personal weaknesses or any character defects. They can also be a result of stress in the work environment or any social environment. A lot of times they are due to family circumstances. We often see children who are experiencing a divorce in their parents' marriage have anxiety or depression as a result from that. A lot of times when people go through traumatic experiences, they suffer from PTSD, which is a type of anxiety disorder. It's post-traumatic stress disorder. All these things are mental illnesses or conditions that affect our behaviors, our mood, and our thinking. So it is very common and it's normal. We all go through these things and we all need to find a way to cope with these things. So as we talk about coping, some of the treatments that mental health offers are usually based upon individualized plans. These are developed collaboratively with your mental health clinician and the individual. Families may also be included in the treatment plan. It's up to the individual, of course. These treatments may include psychotherapy, which is talk therapy. That may include cognitive behavioral therapy, which is known as CBT, which basically helps with thought process. I have a little model of something that is used frequently in a therapy setting or a classroom setting when you're learning about thought process and CBT. So basically, it is how we process thoughts and how we are able to change them as we realize that there are different steps to take. First, you have your situation, which is something happens that cannot be changed. There's no going back. Then you have your thought, which is the situation, how the situation is interpreted. Then you have your emotion, which is a feeling that occurs as a result of the thought. And you have a behavior, an action in response to the emotion. So as we see here, it's a process. And as we learn every single step of these and learn that the more we are able to get rid of unrealistic thoughts, we're more likely to go towards positive emotions and positive behaviors. So that's just kind of an example of something that may be used during a therapy session. Another treatment is medication. Medication is said to be most effective when hand in hand with talk therapy. So that is just another treatment. And like I said, it's totally up to the individual and the mental health counselor or clinician you are seeing. Most importantly, I want to talk to you a little bit about what we can do to help end the stigma. How we can, by educating each other, we can help those who may be struggling and those who might struggle with it at one point, there are resources that are available to you depending on whether you have insurance, don't have insurance. There are resources. So don't ever hesitate to ask for help. It is okay to ask for help. It is normal. We all have trials. We all need to learn better ways to cope. So I wish that you will help someone or encourage someone to seek for help if they feel they need help. If you have any further questions, you are welcome to ask me. I'm not a professional, but I do have a passion for mental illness. So if you want, you are welcome to reach out to me. I hope you learned a little bit of something about mental illness. If you have any questions, like I said, contact me. Thank you.